Rebecca Allewine. Today I'm speaking about the perception of reality in Alzheimer's care, specifically reality orientation versus validation therapy. So we can get a better picture of how many people are affected with this devastating disease, I want to give you some statistics. From the March 2012 report in the Journal of Alzheimer's Association. According to this report, 1 in 8 people aged 65 and older in the United States are living with Alzheimer's. It's the 6th leading cause of death. Every 68 seconds, someone in America develops this disease. These stats are particularly important as the first baby boomers start to turn 65 this year, so we're going to see those numbers increase. When we think about these statistics, it's overwhelming to think of how many families will have a loved one affected. When I speak about reality orientation, I'm referring to the blatant, truthful, however blunt approach that orients a dementia patient to the present time, place, and person. Orienting these patients is impossible because in Alzheimer's, the past becomes the present and the present is forgotten. Reality orientation causes increased anger and frustration and anxiety for these patients. A perfect example of the detrimental effect of reality orientation can be demonstrated in the following scenario. Imagine an elderly woman asks for her husband many times a day, every day of the week. The caregiver that uses reality orientation will tell this patient that her husband died 15 years ago. Every time she asked. Can you imagine her having to relive the pain over and over again? Is it really necessary to upset these patients, causing anger, sadness, and frustration daily? Or is there a better way? According to Jacqueline Marcel at healthcentral.com, when illogical demented episodes occur, you should realize that your loved one may still be trying to work through unresolved issues of a lifetime. Validate feelings, don't contradict, and go with the flow, which may help them meet some degree of closure in their lives. This introduces the idea of validation therapy. It's a method created and researched by therapist Naomi Fell. She created this method to combat the negative outcomes of reality orientation. In a CNN News article, Ms. Fell offers the following information. Forcing the Alzheimer's afflicted to face reality can often be counterproductive, Fell said, explaining that when patients become confused, they tend to turn inward and lose their desire to communicate. The idea behind validation therapy is to just let them talk and act as if what they say is perfectly fine. Even when they appear to be living in another time or place, or are confused about who is who. The old person who is confused then knows that you respect them. They have intuitive knowledge that they may have lost clock time. They may have lost speech. They don't know who you are, but they put you right in their world. There's a theory that as people age, they need to express unfinished issues. Personally, I've used the validation therapy technique in a professional capacity as I've worked with Alzheimer's and dementia care patients over 3 years, and I've seen time and time again that validation therapy works extremely well. Upon the premise of validation therapy, let's think about Erickson's psychological stages and their importance, specifically in ages 65 and older. He called the stage ego integrity versus despair. Older adults need to look back on life and feel a sense of fulfillment and essentially find a certain peace throughout the final stage of their life. I believe that though cognitively impaired, this remains an important step in the journey. They may have the need to meet and express these needs differently due to the memory loss, but it is no less important. As caregivers, we can help them meet those needs and find peace. Finally, caregivers must educate themselves on the negative effects of reality orientation and recognize and respect the basic psychological needs of these patients. Pride and intelligence remains intact for these people. Caregivers must educate themselves on the principles of validation therapy to learn how to decrease the level of anger and frustration and emotional pain that results from the outdated use of reality orientation. Enjoy every story or memory just as it stands. No corrections, no additions, and without explanations. Allow patients to tell each story in their own perception of reality. And I would just like to wrap it up by saying I have seen both in my time as working as a nurse with dementia patients, both reality orientation and validation therapy. With reality orientation, I have seen many tears shed over these patients having to relive traumatic episodes in their lives over and over again. With validation therapy, you give the patient time, you listen what they're saying, you allow them to respond to you as you take yourself to their reality. And every time you'll see decreased episodes of anger and frustration and emotional outbursts. It's better on the caregivers and it's better on the patient.